INICET is a previous year topic based exam. So most of the questions that come in INICET are based on the previous year topics of INICET, because INICET Q bank is cumulative, means they have a set of questions and on them they add on new questions. So I have made a previous year topic list of INICET, and as you can see that 140 questions came in INICET November 2025 from this list. So let's see the important topics. You can purchase this list. The link is given in the description box below and pinned comment section. You can go for INICET, NEET PG and FMG combined list also. With that, you can get a strike rate of 140 to 170 questions in the NEET PG and INICET. Neuroanatomy is very much important for the INICET. So muscles of mastication is very important. The ones which are highlighted have come more than two number of times, and which are VVI, they have come more than five number of times in past 10 years. So I am only saying the VVI ones. Base of skull, all the structures passing through the base of skull and the various foramina. Pterian is very much important. Blood supply of brain is very much important. Branchial arches is very much important. Nerve function and injuries, especially the upper arm nerve branches. If you are new to my channel, then do consider subscribing, because I will help you crack NEET PG, INICET and FMGE. In physiology, cell junctions and transport are important. Titannizing frequency, many questions have come. Sometimes they have shown with the graph the frequency, and many times with image based questions also it has come. Sleep cycles, image based question, any REM sleep has come lot number of times. Factors influencing the GFR is important. In biochemistry, most important is the glycogen storage disorders, and the genetics part is very much important for the INICET. PCR has come many number of times, and vitamins is also important for the INICET exam. In pathology, coagulation pathway, inheritance disorders are very much important. Hodgkin's lymphoma and all kinds of lymphoma, leukemia, hematology section is very much important. uh, the applied aspects, the internship aspects is very much important. So blood storage files, these are very much important for the pathology aspect. In systemic pathology, lung cancer is very much important. Some histopathological images are also asked. In pharmacology, teratogenic effects of drugs is very much important. Sometimes they ask regarding the teratogenic effects of valproate, alcohol, sometimes tobacco also, and sometimes ADHD caused by SSRI. They ask it frequent number of times. Anti-cholesterol drugs, anti-diabetic drugs, monoclonal antibodies, too much important. A free list for monoclonal antibodies notes is also there. You can check in the description box below and pinned comment section. Anti-tubercular drugs and their side effects is important. SGLT2 inhibitors, they ask repeated number of times of questions that which drug causes amputation, which drug causes UTI, most common side effect of SGLT2 inhibitors. Lithium, the blood level of lithium and the side effects of lithium is very much important. Anti-cancer drugs as a whole is very much important. The newer monoclonal antibodies in this aspect is very much important. Recent FDA approved drugs starting from 2018 you should know. In microbiology, sterilization is very much important. The whole of mycology is very much important. Candida, chromoblastomycosis, sporotrichosis, which all other diseases have sporotrichoid pattern, that is important. Rhizopus versus aspergillus, they gave n number of times in microscopy. In the recent year November also they gave the same questions. Parasite eggs and ova is also important. In virology, parvovirus P19 is very much important. FMT, Marshall stride has come some number of times. In the recent year, poison management has come, mercury poisoning has come. PSM, epidemiological study types are important. Biostats as a whole is very important. Vaccines has come a lot number of times. Vaccine while monitor has also come. Dog bite management, they love to give which antibiotic you prefer in case of a dog bite, they ask. ENT, the auditory pathway was very commonly asked in the year of 2022, 23, and 24. in this 3 years only 5 times the auditory pathway was asked. Nowadays less number of times it is being asked. Ophthalmology, they give a bit of haywire questions, so most important topic as such, frequently repeated topic more than 5 number of times in ophthalmology is not there. Sometimes they give corneal ulcer, keratoconus, glaucoma, layers of retina, but they give a bit of haywire and difficult questions in ophthalmology. In medicine, the ECGs are important. Acid base balance is very much important. The emergencies like tension pneumothorax is important. After that, infections like COVID-19, dengue, and HIV are very much important. Infections is not that much important in the NEET PG aspect. Pediatrics milestones they love to give. NEET PG does not focus much on milestones. They love to give neonatal jaundice and its management, severe acute malnutrition definition. NADA's criteria also they have given in the recent years. Surgery GCS is very much important. Burns is important and their management. Bile duct injury is important. Acute pancreatitis and its management. The scoring systems are important. In OBGY, physiological changes of pregnancy induced hypertension is important. The drugs that are used in postpartum hemorrhage is very much important. In gynecology, ovarian cancer is important, cervical cancer is also important. Types of amenorrhea and causes of amenorrhea is important. Contraception is very, very important. Psychiatry, more of the substance use disorder is more important for the INICET aspect. As you can notice that the number of questions which are asked is also mentioned. So anesthesia is pretty low weightage subject. Main important thing is the CPR. Orthopedics, giant cell tumor is their favorite topic. They go roundabout and ask about the giant cell tumor. Which cell is the malignant cell? The mononuclear cells are the malignant cells. The X-ray of giant cell tumor they give. Angspon is very much important for the NICT. Osteoporosis also they love to give. Radiology is more of integrated fashion, so as such, many times repeated topics are not there in radiology. Coming to dermatology, leprosy is very much important. Herpes zoster is very much important. Psoriasis is important. So this is up for today. If you want to have the list, check the description box below and the pinned comment section. Now you can see the video on INICT strategy and how is INICT different from NEET PG. So go watch it now, guys.